Now, we know his next court date is set for June 26th. That will be when his preliminary hearing is held in Idaho. Right now, we want to do a deep dive with an expert panel. I have with me in Los Angeles, California, forensic psychiatrist Dr. Carole Lieberman. Thank you so much for giving us your time. Dr. Carole, I'd like to start with you, if I may, please. I know you've reviewed that article in the New York Times and everything that was uncovered with their reporting. And when you hear these various terms used to describe Kohberger, he's saying, anxious, isolated, depressed, no self-worth, feeling no emotion. What kind of person is this that we're looking at here, please?
Well, what these posts show is that by the time, this was when he was about 16 years old that it started, and it shows that he really has had some trauma or traumas by then. In other words, he's a petri dish of psychopathology. And clearly there must have been some really interesting things or detrimental things, clearly traumatic things that happened during his childhood that, made him this way. And what's interesting is that he was born in November of 1994, and his parents filed twice for bankruptcies, 1995 and 2010. And so right after he was born, they were in this, financial, having a lot of struggles. And whenever there's something like that, that affects all the family members. But there's more than that. He talks about also snow, visual snow. I know we're going to get into that. And that also, yeah.
Go ahead, Dr. Carole, and then I want to make sure I hit that point with you, please.
Okay, well, I mean, there's, he's talking about visual snow, and he comes up with a lot of different explanations for why he has it, which, for example, he talks about that he thinks, well, sometimes he talks about that he thinks it's from toxins, like too much sugar or too much starch. But then he made this quote: "The ringing in my ears and the fuzz in my vision is simply all of the demons in my head mocking me." He wrote this in 2011, so when he was 16. "I fall asleep, but I wake up quickly to bloody screams." Now, that at 16, so clearly the things that have made him tick today, were there by the time he was 16.
Dr. Carole, visual snow. So from what I understand as a layperson, this is like seeing fuzziness, kind of like we see on a television screen sometimes. If the signal isn't good, it looks like, we use the term snow. Is this something that's recognized in your profession of psychiatry?
Well, it's sort of a combination of psychiatry, neurology, and ophthalmology. No one really has the answer as far as what causes it, other than to say that the brain processing problem in the occipital lobe, that is the part of the brain in the back of your head, and that is what deals with vision. But they used to think that it was a migraine, and it is a separate entity than migraines, although migraines are often associated with it.
Okay. And then kind of just backing up for a second, for anybody who is kind of wondering, and I've seen a lot of speculation online, is this guy a sociopath? What do you think, please?
Well, yes, there are signs of that. I would love to have the triad, of course. I'd love to know that he had that he tortured animals. I think it's probably likely. Bedwetting, we don't know. Setting fires, we don't know. But those are the things that one sees as a child that predict a future sociopath. I mean, obviously, killing 4 people is sociopathic, regardless of the motive for that, So, yes, I think we can safely say that that is part of his psyche. But again, he is a petri dish of psychopathology. There is so much there.
A lot to talk about. Appreciate it, Dr. Carole. Dr. Carole, want to go back to you, if I may, please. In some of these posts, Brian Kohberger was said to have expressed how he was experiencing suicidal thoughts. What I'm curious about is, if someone is truly suicidal, why is suicide not the next step for them? And here we know what is alleged to have been a step in a terrible direction, according to investigators in Idaho. 4 homicides is what they're saying this guy did. Why something like that allegedly and not the suicide if he is truly suicidal?
I mean, why didn't he actually go through with it?
Right.
Yes, I'm sure the families are probably wishing that he had. You know, friends and so on, people who knew him are saying that after he got clean from heroin, that he got himself together and then got focused on, if not obsessed on, studying criminology. And, you know, it's so interesting. I had said that he took psychology first as an undergrad and then criminology for a master's. And now, of course, he was going for his PhD in it. It's really interesting. I had said that this was to understand himself first and foremost, to try to cope with the demons that were telling him, giving him homicidal impulses, demons where he recognized that he did have these murderous impulses. And at the same time, also trying to learn how to commit the perfect crime. And at the same time, ultimately, he would let people know that it was him because, what's the point of doing the perfect crime if you don't eventually let people know that you did this, that you accomplished this. So he sort of he got clean, he turned from his other obsessions or his other concerns and so on to focus. And what was interesting is he wanted to be a counselor for people. I mean, this so fits with wanting to take care of himself. He wanted to be a counselor for criminals.
Yeah, this is all quite mind-blowing, Dr. Carole. And kind of as a follow-up, I wanted to touch on something that you said about him wanting to be caught, and I'll come back to you in a moment. Dr. Carole Lieberman, let me go back to you if I may, please. Want to pick your brain about a theory that's been floated out about there, that Brian Kohberger might have had an incel complex. Incel, for those who may be unfamiliar, a term that someone is involuntarily celibate, particularly referring to men who might struggle to have sexual relationships. And it's kind of a subculture, and this term has been tossed around a lot online with respect to him. Tell me what you think about that theory, please.
Well, yes, I started it. I was the first one to have said that.
And I believe on Court TV, right?
Court TV was the first time, and then I said it again, but also in Newsweek. The reason why I came to that conclusion early on is because once I knew two things, that the scene was incredibly bloody and vicious, like animalistic, and two, the targets, the people who he killed. Because incels, involuntary celibate, these are men who build up rage over the years because of being rejected by women. And they want to have women to sleep with them and to date them and so on, starting out with normal kinds of wishes, expectations, but getting rejected. And as each rejection builds up more rage inside of them. And so the people, his targets, were the perfect people in terms of who incels hate, who they have this rage towards, because the women were beautiful and smart and had it all together and popular in sororities. These are the women who incels think would never go out with them. And so that's why they build up all this rage. Now, why Ethan was killed too is because they also have a hatred or a rage towards men who get to be with these women. They are angry at them. Why should they get to be with them and I'm not? And so it makes perfect sense that he chose these targets.
Appreciate it. I know we're going to continue the discussion in the days and weeks ahead on this case as we continue learning more details. I want to say a special thanks to Dr. Carole Lieberman.